So hello everyone, welcome to the S.A.M.E, that is Study Art Motivation and Education, and in this video we are going to continue the nasal septum part. In the last video we have discussed about the introduction and the parts of the nasal septum. In this video we are going to discuss about the arterial supply, venous drainage and the nerve supply and the lymphatic drainage of the nasal septum. Okay, so anterior superiorly, AS, AI, PS, PI, that is anterior superiorly, anterior inferiorly, posterior superiorly and the posterior inferiorly. Anterior superiorly, it is supplied by the anterior and the posterior ethmoidal arteries. Okay, anterior inferiorly, it is supplied by the superior labial, which is the branch of facial artery, and the anterior and the posterior ethmoidal arteries are the branch of ophthalmic artery, which is the branch of ICA, that is internal carotid artery. Okay, then posterior superiorly, it is supplied by the sphenopalatine artery, which is the main artery here, and the posterior inferiorly is supplied by the greater palatine. These two both are the branch of the maxillary artery. So posteriorly, the arterial supply of the nasal septum is majorly by the maxillary artery. Now facial artery and maxillary artery, both of these are the branch of the external carotid artery. Now one thing which you have to remember is at anterior inferiorly you will get a large capillary network which is called Kesselbach plexus, okay, which is the common site of bleeding and which is also known as the Little's area. This you have to remember. Okay, now the venous drainage is anteriorly by the facial vein and posteriorly by the sphenopalatine vein to pterygoid venous plexus. And coming to the nerve supply, the nerve supply is by two things, that is general sensory nerve and the special sensory. General sensory nerves are majorly by the trigeminal nerve. Now anterior superiorly by internal nasal branch of anterior ethmoid nerve, and anterior inferiorly by anterior superior alveolar nerve, posterior superiorly by medial posterior superior nasal branch, and posterior inferiorly by the nasopalatine branch, which is the main nerve. Okay, and both of these are the part of pterygopalatine ganglion. Now coming to the special sensory is very predictable that it is supplied by the olfactory nerve, which is from the upper part, and the lymphatic drainage posteriorly by the retropharyngeal and the deep cervical nodes, and anteriorly by the submandibular nodes. Okay, so this is all about the arterial supply of the nasal septum, nerve supply of the nasal septum, and the venous and the lymphatic drainage of the nasal septum. Okay, so this is all about it. In the next video we are going to discuss about the lateral wall of the nose. Thank you so much for watching this video. I hope this video helps you in academics, and if it does, then I would be really grateful. Thank you so much.